And one of the things, recording, and one of the things that really strikes me when I think about these last couple of years is that every single decision had a cost and a benefit. And it wasn't always apparent what the cost and what the benefit were at that moment. And sometimes it was apparent to one person, but not to another person. But I think looking back, and people will be looking back in 20 years and in 30 years and writing really big studies of what happened to 5-year-olds and 10-year-olds, during this time and what happened to them down the road. But I think tonight, I hope to talk about some of those costs and benefits and how they changed how we think about what this sort of unique moment in our lives that nobody who's on this panel certainly had ever seen anything like it. So let me just start in, and I'm gonna just start in on the questions, and I'll get to each of you, and hopefully we'll go around for a few rounds. And I should say, if you're listening and if you have questions, you can put them in the Q&A or the chat, and we will try to get to a few of those. But let me start with Dr. Shira Doron, who's the hospital epidemiologist at Tufts Medical Center. In the Massachusetts Health Council's report, there's a really interesting piece from Marcia Testa at Harvard School of Public Health that raises some very difficult questions about when people look back in 20 years, how are they going to think that we dealt with issues of quality of life and some of these costs and benefits. And I wonder, how do you think we did? Obviously, in March of 2020, we didn't know much about what COVID-19 was, but how do you think we did thinking about quality of life, lives lost, years lost, and all that?
I think we did some things well and we did some things less well. When the decision came to close the schools in March of 2020, I had some strong initial reactions as a healthcare worker and as a healthcare epidemiologist. As a healthcare epidemiologist, my first thought was, can this be right? I was in a similar role in 2009 when the H1N1 pandemic began, and children in school were catching H1N1 and getting really sick. And in 2010, the CDC issued a really strong statement against closing schools. And the rationale was that, I have it written here that that children would lose too much and their parents would lose too much, even though there was this danger from the virus. And H1N1 was actually a more severe threat to children, although less so to adults than COVID-19, that healthcare workers themselves would not be able to handle, to be in the hospital if they were staying home with their children. And none of those things really were different with COVID-19. As a healthcare worker, working here in the hospital, surrounded by people in a command center, controlled chaos, getting ready for a surge that we knew was coming. When I heard that the schools were closed, my first reaction was, how are we supposed to keep working then? Key members of my team literally left. Some of them worked all night, shifted to night work, even though our job is not night work. Shifted to night work and worked all night and were home with their children all day. Others that couldn't do that, our housekeepers, our transporters, surely left their young children home alone, but shame did not allow them to talk about that. And eventually, emergency daycares opened for those of us who could afford them, and those children were just together again in daycare instead of in school where they would have gotten a better education. So, I think we had some lessons that we could have learned from H1N1. We didn't apply them. We now can look back and say, perhaps we didn't need to do that, given that we now have experience keeping schools open. But we learned a lot. We did a lot of good things. We figured out how to do testing. We figured out what kind of testing is best. We figured out how important ventilation is. We figured out how to mitigate the spread of infection within schools. And we can use a lot of those strategies going forward as we need them.
I want to turn to both of the superintendents and ask both of you, you know, people often talk about like the states as being laboratories of democracy. And this was like that taken to a quite a I don't know, crazy level where you had every state really doing something a little bit different with schools. And not only states, this was an international thing. So not only did Texas behave very differently from Vermont, but you had, you know, countries where schools were closed longer, and then you had countries. I talked to somebody recently in Denmark in a school of education. They reopened, they also closed almost exactly the same time, but they reopened mid-April 2020. So you had like everybody doing kind of their own thing, both within the US and then, because this is really a global pandemic, outside the US. So Julie, let me start with you. Since there were so many different models, do you feel like Massachusetts got it just right? Did you look around at other models and think about those? Where do you situate us in all of what you saw?
Well, I think that with every conversation like this, we should start with what we did right. And I think that that's part of what's been missing in the conversation. Lots of regret, lots of blame, lots of finger pointing, lots of negatives. And I think that a whole lot went right. Crisis leadership is entirely different than the day-to-day leadership. And I think that also needs to be acknowledged. I also want to say that I went to a group of superintendents on March 12th, which was before the governor's announcement. So I'm getting ready to take a big hit here, and said, you know, we've been following the pandemic since January. In Lexington, we have a high Asian population. They had many connections to Wuhan. We had experts in the community telling us that this is extremely different from H1N1. And I was also a leader at the time of H1N1. I was deputy superintendent in Brookline at the time. What was a little different about that experience compared to this one for me was that Mass Department of Public Health was on the phone with me in Brookline talking about, what are you seeing? What does it look like with the kids? How are they presenting? How are you organizing? And that probably had a lot to do with the fact that we had a lot of connections in Brookline. So a concern would be, does everybody get that kind of outreach? But it was a good model that seemed absent in this time around. So Middlesex League superintendents got together and we said, like, you know, we have significant enough concern in our community that a closure makes sense. Let's just take a 2-week break and see where we are. So that was March 12th. The governor announced the emergency closure on the 16th, I think you said. And then we were organizing during those 2 weeks. So we were following CDC guidance, getting plans ready for if it were a longer term closure, and doing a lot of the organizational work that you can't do and run a school, just like Shira, is it Shira? Am I saying that correctly? Just like Shira was saying with hospitals, you have to, you know, be there to be able to get the work done. You have to have the space in the room to be able to do the thoughtful planning that's required for something like this. And I think what the educators did in Massachusetts and around the nation is pretty remarkable. They put together, some of these people had not even been on a computer. I didn't know what Zoom was. I had my first Zoom meeting with a student, said, you know, a student school committee representative, and said, can you please help me try to teach kids, little kids, this is a high school student, how to know what remote learning even is. Can you help me put it in kid-friendly language? That was my first Zoom meeting. So the learning curve was steep, but I think we got a lot of things right. One of the things that I think we got right was cutting the curriculum by 50%, taking the foot off the gas and saying, slow down, everybody, because we're all processing this while we're leaders and teachers and hospital workers and epidemiologists and all of that. We're also moms and dads and brothers and sisters and daughters and, you know, all of that. So I feel like a whole lot was right in that regard. I'll stop talking because I want you to get to other people.
Well, Thomas Anderson at Superintendent of New Bedford Public Schools, you know, feel free to springboard off anything Julie said, but kind of same question. You were watching, you were in one school in one state, 50 different responses, but that's just America. Then you've got, you know, Japan's response and Denmark's response and all this stuff. What did you see and how did you situate what, you know, your own world in that kind of larger, like, here are all these different ways that we could be going?
No, thank you. When we look at it, into, you know, to some of Julie's points, it's like people had been discussing it, had been getting together. And I think one thing in New Bedford that was a tremendous help in terms of what the city did. So the mayor, so there were basically 5, they've still lasted. There have been 5 COVID meetings a week where we dug down into the data, looked at different neighborhoods and those type of things. So there were some very clear-cut processes that were put in place after this. So as we're leading up to the possibility that schools might be closed, we had started preparing certain things, but we hadn't made a decision. So my thing was, we're not going to have any control over this. We're going to be forced to react to it. So let's start preparing, you know, getting learning packets, start assessing the number of computers that we have. You know, we'd already gone 1-to-1 at the high school level. We'd already rolled them out for middle schools prior to this. So we had kind of positioned ourselves just in general to make some of those things work. And so when this came about, it was one of those things that you can't stand there and be shocked and say, okay, what are we going to do? We just have to move forward, making sure that we're looking at how we're going to take care of students in terms of, you know, an equitable standpoint. We knew that many of our students, you know, just like a lot of other places, depend on school for lunch, you know, for breakfast, lunch, for shelter, and those type of things. So we had moved to determine how are we getting all of those positions in place in terms of our cafeteria staff? How are we going to work that out? We had some initial conversations with our bargaining unit, so all of them, so the teachers, the paras, the building service teams. So that helped in terms of when we fully got into this, and some people had said, you might not be going back, but I'm thinking optimistically, well, what's the evidence that we're not going to go back? But then of course we didn't go back. But all of those initial conversations is what really helped position us in a way, and, you know, the support of the community, but just the over communication about it and saying, you know, we're following the medical, you know, we say follow the science. We're following, you know, the medical community and what they're putting out and what they're sharing, and really was just trying to get everyone on the same page to understand it and not get into whether we believed it or not, what direction we should take, but really be unified in understanding we don't have any control over this, and that's a hard thing. And I was actually a principal in Maryland when the H1N1 came out, and it was totally different. I mean, at a principal level, you know, we cleaned the mats, we did extra cleaning, you know, for the right. I mean, those are the type of things we did. We never closed schools. There were 200 schools in that system, and so you kind of learn from there. But then coming where this is totally different. It's hard to even. My thought process then, when we're dealing with H1N1, was nothing compared to this. And just the level of anxiety every day, trying to figure out what are we going to do in the best interest of everyone. And it wasn't just how we're taking care of our students, but what are we doing for our staff? And, you know, just one other point about that, I think that's really what helped us manage just the overall communication a lot. And that just goes with all of the different organizations that we had to try to work with. And again, just trying to get people to understand and not make it as much of, how to put this, as much that it has been from a political piece, trying to stay away from that and make sure that, look, we have real people in front of us, and we need to really focus on how we're going to handle that.
Beth Kontos, president of the American Federation of Teachers in Massachusetts. You were looking at all these different districts, and when you think about districts going back to school, there was a big range. You know, some came back really in the fall, like pretty early in the fall, and others not, you know, it was closer to maybe February. I mean, you can correct me, what, like some of the later districts.
Yeah.
Did you feel like, you know, I wonder what you were hearing from members, if you felt like we're going back too soon, there's too much remote schooling? Like what, you know, when you saw that big range, and what were you thinking?
You know, Kara, I represent districts that are very different from each other. So we have some districts who had all the resources available to them and were able to revamp their ventilation system while we were working remotely. And we're coming back to a school system that was ready, or at least felt more ready. And then I had other districts that were in such poor shape before the pandemic, when there was no problem with what you were breathing, or, you know, whether your windows opened. My own classroom, when I was teaching in Salem High School, I taught in one of the interior rooms with absolutely no windows. So suddenly the school had to stop using all of those particular classrooms. So if you're already in an overcrowded situation, now you're only using some of the classrooms. You have to be careful how many people are in a room. So that type of a school system that has those issues might have to come back more slowly, maybe go into hybrid, which many were. But one of my districts I have to think about was well-resourced. Their elementary schools were able to come back 100% in attendance in person because they had space. Mm-hmm. They used everything they could, a library, an auditorium, a gym, and they put a big tent in the parking lot, and they could eat outside. And, you know, it was significantly different than one of my schools who doesn't have that extra space to expand, or the resources to do it, or even a library that they could expand into. So the pandemic showed us the glaring differences between some of our districts. And I know between Julie and Thomas's district, they're very different from each other, right? That's the inequity that we need to figure out in Massachusetts. We can decide to do better than this, because unfortunately, I think there'll be other pandemics in the future, or other kinds of health concerns that we can start mitigating now with, you know, the funds that are available for us to do this, and just make a laundry list of what needs to be done and prioritize and just get going and do it.
But it sounds to you like the salient difference in remote learning was money. I mean, like, yeah, maybe in crude terms, but was money.
It's true. I'm sure in New Bedford, not every child had Wi-Fi available to them. I know Springfield, not every child had Wi-Fi. I know in Lawrence, not every child had Wi-Fi. We did a good job distributing devices, but not every child could access the internet in as equitable a way as in another. Well, it's family wealth was part of that, right? Sure.
Vatsady Sivongxay, Executive Director of Massachusetts Education Justice Alliance. I feel like this is a great point to pivot to you, because you know, when I think of some of the things that Beth said, and then some of the things that Shira said, there are these sort of two sides here, especially if you're thinking about the issues of equity and justice. Kids who have less are often the most likely to be left alone, because like their parents still might be like, you know, driving a bus, or they might still be a janitor, and like you can't do that on Zoom versus being a lawyer, say. So they might be the most likely to really not get the kind of education or even supervision that they need. But also they may be in a community where people feel most vulnerable to COVID and are getting the sickest. Those seem like two, like when we talk about cost and benefits, impossible things. How give me a sense of what you saw, and like, how do you weigh those things or think about them?
This is a question, as a parent, right? How do you weigh those? I think I can share a little bit. You know, I'm from a refugee immigrant household. You know, I grew up in a place where my parents really relied on other family members and community members to get the information, and relied on the education system to provide critical information about opportunities, about health access. And so coming from that personal perspective, I saw the disparities in our immigrant and low income and BIPOC communities where, you know, when the schools decided to go remote, the parents definitely didn't have the flexibility. Our most vulnerable and marginalized communities didn't have that flexibility, as you'd mentioned, right? But at the same time, they had to make a really difficult decision of whether to stay home, right, to help their child with the education. Were they going to like become, you know, meet in community with others so that like other parents and other grandparents or aunts and uncles can help take care of it? But then that like increased the risk. In addition to that, like who in our community can actually guide the kids and understand English well, right? So there was like, if we think about our most vulnerable, marginalized communities, we're thinking about our low income immigrant BIPOC community, and they were placed with a lot of burden. But remote learning really allowed them, the good thing about remote learning was that it really allowed them to think about what was the most important thing for their family, and that was the health of their younger kids and their grandparents or their aunts and uncles who they might be sharing a living space with, right? So they had to think about the risk and the benefits. And what we heard was that, you know what, maybe one of us will work, one of us will stay home, right? Who's making the most money, like who is going to be in the most safe space. And that really varied among jobs and varied among families. But I think remote learning allowed that for them to think about it. And as the superintendent said, like when they were able to slow down, when we were able to like cancel the MCAS, you know, or postpone it, it gave the families just more room to breathe. You know, we had our son in care, and when that care shut down, we were lucky that like my husband and I, my husband's a professor, we were able to work from home and divide our time. But it was still challenging for us because, you know, our family was really far away, so it was just us, and that meant that our son really had to be very focused, get online, listen to the teacher. So there were some skills that were learned there as well, and in some losses at social emotional loss, right? Like how do you interact with another person when you're upset with them? How does a child convey you know, their thoughts to or their confusions, right? So that was a challenge for students as well. But I think that when you think about the risks and benefits for our most vulnerable families, I think you'll find that going remote, taking it slow, having a clear message, being consistent, making sure that, you know, the state, the administrators, the educators, the caregivers from like preschool or, you know, childcare all the way to college, if the message was consistent, it was much easier for like an immigrant, low income BIPOC family to understand, you know, what were the risks and benefits and how would they move to ensure the health and well-being of their families. And I think that's much different from an affluent family, right, where you can pay for a child care person to come, and that child care person would, you know, wear the mask because you're asking them to. Like you can get Uber Eats, you can get Instacart, you can do all of that, right? So like there is more opportunities for you to provide for your family, whereas like immigrant BIPOC family, you have to plan a lot. You have to give them space. You have to give them room, resources, funding. And when you think about the funding and resources, which I hope that we could jump into much later, the districts that need the most resources have historically needed the most resources, right? Whether it's like the nurses or school counselors or para or family liaisons. When remote learning happened, we saw the disparities as folks have mentioned. And so there's an opportunity for us to really think about, okay, we saw that, it confirmed, right? It confirmed that we need to get more resources. So now what's the plan? Like, what's the action that we can take based on what we have learned?
Russell Johnston, the Deputy Commissioner of Education, let me turn to you. At the state level, Governor Baker seemed to try very hard to get kids back into school full time. And I really remember in the fall of 2020 that was something he was working on, though I think he was probably, you can correct me if I'm wrong, I think he was probably less successful than he would have liked. I think he even said that. What happened, is there something that, obviously he wanted a certain outcome. Is there something that he could have done or the state could have done to get that outcome, which was, i.e., to get more kids in school full time?
Yeah, it's hard right now to go back and completely recreate what happened and look at it and say, what would we have done differently? There was so much that we didn't know about COVID, right? And so we felt like it was really important to put out there as, so that local decisions could be made and, doing what was in the best interest of the students who the districts are serving. And so not having a statewide mandate, but having there be some, really just gathering the facts, making local decisions at the time was an important way of doing the best that we could with the information that we had. And not unlike what Superintendent Hackett said, I do want to focus on the positive things that happened though during that very uncertain time. And one of the things that I applaud all of our districts for is really working hard to figure out who are the students who were most vulnerable and needed to come in even when they couldn't have all of the other students come in. And I think about all the students, particularly students with more significant disabilities who were welcomed back into schools starting in the fall of 2020, even when it was so uncertain about, can we do this for more? Can we do this for all of our students? Our school district said we have to do it for those students who cannot access remote learning. And yes, there was some variation in that from across the state, but a common variable was the return to school for our children with the most vulnerable needs. And I really applaud our teachers who were so willing to come in, our teachers of students with disabilities, who were the first ones back in many cases, and who came in such uncertain times and who put themselves out there to say, I believe in our children. I believe that I have to do this because it's a privilege to serve these children, and it's not okay for them to not access education. And I think that, we really, it helped to get the ball rolling. It helped to show what we could do safely. It helped to build up our mitigation strategies. And I just applaud those educators for being on the front lines of this all across the state and the great work that they did. And, I'm pleased that by the spring of 2021, how many students we were able to return to school. We sort of built on that momentum. And I'm so pleased that we've been able to maintain as much in-person learning this year as we have. And so I can't go back and say, exactly what we could have done differently when there was such uncertainty at the time. But I am proud of the work that was done to get us to where we are now, and particularly those early wins, that early vanguard that so many of our educators were willing to put themselves in to make that happen for their students. And I think it's just an important lesson to remember.
Shira, Doron, let me come back to you. You wrote, I think in the Mass Health Report that we were talking a little bit, Russell was talking a little bit about kids that are at risk. And I think you wrote that the risk of death from COVID in ages people 5 to 44, the number of people who died was less than the number of people who died from suicide during the same time. And you've made the case that the need, the people who were in need was maybe a broader slice of people than we often think about in terms of like who is actually in need. I wonder if you can talk a little bit about that and how you feel like that might guide you in terms of thinking about the future.
Yeah, and there's maybe I'll pick up too on the question in the chat, which mentions the precautionary principle, and that's a term that's been used a lot to say, well, you know, we did not know enough about COVID, and we had to flatten that curve, right? That was really important. We saw that hospitals became overwhelmed in China, became overwhelmed in Italy, became overwhelmed in New York City, and we needed to flatten the curve. So I don't think that it was wrong to even do a full lockdown for a brief period of time. I do, in addition to hospital epidemiology, I do antimicrobial stewardship, and it might sound unrelated, but my job is to make sure that people don't overuse antibiotics. So they don't overuse a medication, a healthcare intervention. And a lot of times what I get is, but I want to use this antibiotic just to be safe. And my response is, antibiotics are harmful, therefore that is not the just to be safe strategy. And I would say that many of the things that we've done in the name of preventing the transmission of the virus just to be safe have not necessarily actually been the safer strategy, because they have harms associated with them on both sides, and we haven't often adequately assessed or studied or modeled or really thoroughly assessed which intervention or not intervention has the greatest harm. So I think we really need to do that going forward, this pandemic and the next pandemic. So I think that's what I would say about that. Getting back to your first question was.
Well, you had talked a little bit about the rate of suicide amongst young kids, and I mean, it really goes. It isn't until about 45 that the numbers start to flip, where above that age, more people did die from COVID than from suicide, if you look, but below that age, and that was the sort of point that you had made in your.
And right, so that harm reduction approach, which is, you know, that it isn't simple to say the words precautionary principle and apply it just to being cautious about the virus. We need to be cautious also about every single thing we do to prevent the virus and balance it against the potential harms. Do we know exactly how many children had and adults had an exacerbation of underlying mental health issues because of lockdowns and social isolation? We don't exactly, but we do know that having a lockdown and having closed schools did cause social isolation. We do know that social isolation can worsen mental health issues. We do know that suicide was a crisis even before the pandemic, and we did need to focus on that as well, in addition to other things like sedentary lifestyle and nutrition and abuse and all of the things that we suspected might be getting worse during the school closure period, and were very hard to assess and deal with during the school closure period. So again, I think going forward and looking to the future, because it's not helpful to necessarily look back and reevaluate every step. We really do need to think about how to make sure that those harms don't come to children again.
Thomas Anderson, I want to think about the future, but can you just give me a sense of right now? I mean, and this is like the immediate future. What do you see in the New Bedford Public Schools in terms of where kids stand, what the last couple of years, like where they've put kids? Are they mostly up with grade level? Do you see, what do you see in terms of behavioral issues? It's like, how do you feel like if we had this conversation in 2019, how are things different now when you survey the landscape?
You know, that's a good question. When we think about, one thing we had to remind ourselves that we have these conversations all the time is that there were challenges before COVID. There were things we weren't, in the educational systems, no one was doing perfectly. We had challenges with students that were not receiving the appropriate amount or just the additional amount of, socio emotional support, whether it was counselors or just being able to identify things, being able to provide more supports and resources to teachers and classrooms so they can, help identify it, not put it on them to resolve it, but being able to see what some of these signs are. So when we're looking at and trying to evaluate, and I think, and to Russell's point too, it's hard to go back and say, well, we could have definitely done this differently. I think we're all still kind of going through it because it was a trial, and we're still figuring things out. But the one thing we don't have to figure out is because the data that existed prior to the pandemic is still the same data. So we were in tune to what our math scores were and our reading scores, all of those type of things. How were students coming to school every day in terms of, getting, whether it was a discipline issue or whether it was attendance, what were we doing then? And many of those same situations still exist. And then hearing some of the medical professionals, the challenges that they were facing are still there. The pandemic has exacerbated it. It's really shown a serious light when we talk about the inequities and those type of things. So in New Bedford, what we had done just in terms of I think it was a September 15th date when students, we were able to open schools. We had our most vulnerable population of students in school. So we had over 1,000 students in school for the most part, 5 days a week. Right then, because of that, that communication, and people understood what the challenges that had already existed, and just kind of getting our minds wrapped around, we can't control this, but what we can control, how we have students in our buildings during that time, what supports and resources that we're providing for them. And when we look at, when we think about, I use the word, if we say training or staff development, how are we better equipping everyone else? And just one other point about it, it's, I saw the question in the chat where it said, are we asking too much of schools? I think Julie, we can't say that. The thing is, we're dealing with every student, every staff person that comes to us every day. I think it's our job to do the best that we can and really seek out those resources that are going to be helpful. But in the world that we're in now, there is a lot that's there. And what we continue to do is figure out what are these different strategies that we can work out. And it's not so much always about the resource of money, which we definitely need. So don't misunderstand that but it's really, how are we using it? And again, going back to pre-pandemic and not thinking that some of these things are that new, because in certain communities, they're not. They were ignored a little bit. And now that we have more attention given to them, we're receiving more resources to really jump into it. So I think if we have that, that's kind of how we've approached it. That's been my, approach to it during the whole time.
When you said, just to follow up, when you said things have been exacerbated in the last couple of years, how can you tell? How does that manifest? Like, in what ways are things different than they were?
If we think about just one thing, if we look at we'll just stick to the socio-emotional piece of it. We have more identified situations. I think before, people may not have been they were less inclined to discuss it. They were less inclined to divulge information that may have been going on, on a personal level. We have, again, we had many of our students, and again, that we learned more about some of our adults that were going through personal traumatic situations that we didn't know about. But now when individuals were home, staff included, having to teach it as we're having this interaction right here, it really brought out some other things. It really made us check ourselves as individuals and say, we are struggling with something that we keep suppressing. We now can actually talk about it because it's not seen as much as it was in terms of having that stigma. So that's kind of what I was thinking on that.
Russell, let me come to you for a second. But I'm interested in this from others too, and anybody can chime in. If, let's say, in the fall, so let's push this forward, we see a big surge because this, let's say, turns out, we don't exactly know, it's still kind of new, but it turns out to be a very seasonal, respiratory virus, and there's a big surge. We obviously just saw a big surge not that long ago, and there's a big surge. What would you like to see happen that's different? Like, if you were like, this is the optimal situation, we know this surge is coming, what's the optimal situation to deal with it? What, in your mind, what does that look like?
I think first we start by looking at what we know about what's worked. And I think that we know that layered mitigation in schools can keep students and staff safe. And we've learned a lot about what those mitigation strategies can be. And I think that as we look at the data, we would want to see which mitigation strategies do we need to bring back? and reemploy, and the advice that we would need to give to make that happen. I also think that we've really built, from my perspective, at a kind of a state agency level, a great deal of kind of trust and communication and collaboration between state agencies, and particularly between our agency, the Department of Elementary and Secondary Education, and our allies, our colleagues in public health, both within state agencies, and then of course, great experts like Dr. Doron and others who've, just really helped to guide us and who we've listened to and gotten a wide variety of perspectives. And so I think it would be sort of knowing that we have mitigation strategies that work, knowing that the risk of transmission in schools has now proven to be very low, and knowing that we have a great deal of experts to turn to here in Massachusetts. I think we could pull all that together and just make kind of logical, kind of stepwise decisions about how we can do everything we can to protect safe in-person learning. And it's those three words together, safe and in-person, that really matter for our students and our staff.
Julie, same question for you. If you had a sense of like, yeah, sometime this fall, this winter, this is going to happen, which it may well, would you want to try to keep kids in school full time? And if you did, how would you do it? And so on. How might you, like, now you're going in so much differently than you did March of 2020. You know a lot of things, you've seen a lot of things, like we said, you've seen a lot of different examples of different countries and states that dealt with things differently. What would you want to see happen in Lexington in an ideal world?
Well, I think a response to the new information and the ability to pivot. And people want us to say, this is what needs to happen if masks come back, or this is what needs to happen if schools close, or this is what needs to happen if we're going to be in person. We can't know that. And so I think the greatest gift that we could be given is alignment with decision makers and policymakers. Have the CDC and the Mass Department of Public Health and the Department of Elementary and Secondary Education all be on the same page, because what frequently happened is they weren't. And so school systems were left to sort of sift through the information. And don't get me wrong, I truly respect Russell, great guy. You're working with the governor. I get all those implications. Locally, what happened was, people said, but have you seen the CDC guidance? But wait a second, and Mass Department of Public Health is saying this. And what are you kidding me? You're going to stay open? So there were all of these opinions. And I think if we could just have an alignment of information, we could have a more collective response. The other thing I would say is that there was a real commitment to local control from, I think, Governor Baker, at least that was the sense I had, that's important in Massachusetts. We have a long history of being, we call it embracing our revolutionary spirits in Lexington. But I don't think that that's very beneficial in a crisis situation. So I think some coordinated action that's very organized with outreach perhaps to, I'm a part of the Middlesex League. There are different roundtables for superintendents, having a coordinated system so that we all know what we're doing, we're on the same page. And just one quick side note, when the reduction was made for the curriculum, that was great. That was a local decision. The hard part about it was that it was a local decision. So my curriculum leaders made cuts to standards that probably Tom's curriculum leaders didn't make, and vice versa. We made decisions, and then we were given the test that tests all of those standards, which made it very tricky, and made people frustrated, made data questionable, I think, from our teachers' perspectives. So just again, I guess I'm pitching, lose the local control in those situations and have a very orchestrated, coordinated response.
Beth, I wonder if you think that there should be that kind of centralized control. And then also you made mention before of like going forward, what I'd like to see is this checklist, I think, to help especially schools that are less resourced be able to open maybe in the way that a richer school could. I'd like to know both on the centralized issue, but then also like what's on that checklist.
Sure. So as far as decisions about public health, I think that's something that should be statewide. I think that's why we have public health. I'd like to see a real investment in our public health. I'm sure that there should be guidance that is standard to all of us. I understand that the next wave or the next pandemic, we may be learning, or as they say, building the plane as we're flying it, right? Sure, we understand that. There's a lot we didn't know. I do believe that local control and local school committees have their place. I'm just not sure that decisions about pandemics belong in the hands of people who are community members that were elected to make decisions about policy that have to do with, specifically with education. To me, they're two different things. I believe I could sit on a school committee and make informed decisions. I don't want to be part of the public health decision making because I have a social studies, a master's in history, not science. So I just have to look at the chat for a second because this person, Elise, are we asking too much of our schools? When we're talking about not only all the educational needs, the social emotional needs, which Thomas mentioned, that are prevalent in our that our children demonstrate, but also there's so much our society does not provide for a healthy child to grow up healthy and have everything they need. And we really need, if we want to do this well, we need to refocus what our priorities are, and we need to really not reinvest, because I don't know that we've ever invested properly, but we need to invest in our public school system and our public support system so that our children do have a much more level playing field when it comes to school. And if we have extended day, that's awesome. Some kids want it, families want it. Some families want childcare at school. Some want enrichment after school. All of those choices are absolutely wonderful, but they all cost money. And we need to respect the work of the people who are in our buildings and pay properly, have good benefits, and make schools the place that everyone in our community wants to be. A community school model where there's food available and clothing available as needed, even healthcare as needed, and childcare for the people who work in the building as well as the people in the community. This is really what we need to do to have a society that we all want to live in, and that our outcomes are better for all. Because I know that my community will do better in the long run if the community right next door to me, those kids are also doing well in the long run. We all work together, we overlap, we don't live in a bubble. So part of this is having the proper amount of nurses in a school. We need librarians, we need social workers, we need resources, and human resources are a big part of that. I appreciate giving credit to the adults that were in the buildings during the pandemic. They were fearful for their lives. They were fearful for the lives of the children that were in their classrooms. Many of them were adult children themselves and concerned about their elderly parents as well as their own children. So we have to take into account that people were going to work and were carrying a large burden with them. And part of that is worry. And I know as an individual that's got adult children and an elderly mom, I feel sandwiched in that, worried about, all aspects of that. And as far as when the vaccines were available, I think there could have been a better prioritization about people who were working in person throughout our community, rather than it strictly being, how it was delivered by age. I understand congregate living should have been at the top of the list, but I think anybody in a classroom should have been at the top of the list. Certainly anyone who worked face-to-face in healthcare. But I'm not sure that an accountant that worked for a healthcare industry needed to be at the top of the list when they were working remote, right? So those kinds of priorities, I think, could be rethought in the future.
Can I say one quick thing
go
about
right
that?
ahead.
Just want to pick up on Beth's point. So our fire department had access to 100 vaccines. This is before there was there were 2 days or something at Gillette, I think, for teachers that Governor Baker organized. So they had 100 extra vaccines. Everybody was taken care of that they had to take care of. They gave it to the schools. I worked very hard with my union leaders to identify BIPOC, at-risk, immunocompromised individuals and put them on the list. We got 100 people. Many of these people were living in communities outside of where they work. So they might have been coming to us from Boston or other communities. So it was very difficult, on top of everything else, very difficult for them to get access to the vaccine. And they pulled the plug on our ability to have those vulnerable staff members vaccinated. Mass Department of Public Health called and stopped it. And to me, I mean, I think your questions are so thought-provoking because if we do believe in equity and we know that the disproportionality exists in all systems, including healthcare, why wouldn't we start with exactly what Beth is saying and give it to the people who need it most first?
Vatsady, I wanted to pick up on something that you had mentioned in your last response, which was that many people who are marginalized really felt like remote learning, they felt more comfortable with remote learning, felt safer. And from the data I have read, from the polling I have seen, that is certainly true. The other side of it, and I've talked to Pedro Noguera, who used to be at Harvard, but now is the Dean of the School of Education at USC a couple times during the pandemic. And they USC looked at the LAUSD, that the Unified School District, which is one of the largest in the country, and found just huge numbers of kids like never logged on, 30, 40% of kids it was also marginalized communities who fell the furthest behind, whereas like kids who were wealthier, even if they weren't in school themselves, could figure out if the person sitting next to them had a PhD, they could help them, even if they weren't, they couldn't connect, which they usually could because they had a device and all that. So when you think about that future, we were talking about that next wave, how do you think about those sort of conflicting things, which is that very often the same communities that felt like it was safer to be home, also kids fell the furthest behind or couldn't access things because they didn't have good internet connections, or 5 kids sharing one internet connection and that wasn't going to work, and so on.
Yeah, I think one of the key things in ensuring that our most marginalized and impacted communities don't far further behind than we were before, right? Is to plan with the community. We knew that there's certain folks that did not have access to internet because of where they lived, whether it was urban or out in Western Mass, or in Dorchester or Roxbury or Chelsea, right? We knew that. We also knew that those communities also lived in intergenerational households, where if the parents were gone, the key people in that household would be the older sibling or the grandparent, who would be guiding and caring for that child. I'd have to say that, if my parents were to help me try to do Zoom and I was in middle school, there was no way that they were going to be able to help me, right? I would have had to learn that myself, which meant that there should have, there were STEM and technology and all that all of the access to it prior to COVID, or now here's an opportunity where we can pause and give, perhaps give training to the parents and the caregivers, to the students. But in addition to that, there were some other issues there, right, that that folks have mentioned, that what we need to consider is there's the social emotional well-being of our kids. If we were able to build like a community school where the kid knew, like, hey, I can reach out to this person, right? If I needed help, if I needed to talk to somebody, right? If that community also had enough counselors for that person to like reach out to and really talk to. In addition to that, we know that there's some challenges for students of color to build trust, right? There's history in our culture, in our blood, in our community that like it's much more difficult and challenging for a person of color, a Black and brown student, to go up to a teacher that's white or that's not like them and ask them a question to like build that relationship. So we need to really diversify our staff and our teachers so that our students can be like, okay, I am stressed out about school. I'm stressed out because my mom's working and I have to take care of my little sister. And then like, I might have to cook dinner as well. And what I've heard from some students was that they also had to take on part-time jobs. And that's something that we haven't talked about yet. So there were a lot of different factors and it varied among families. So now we confirm that like those exist, right? So can we take this time now to like plan together with the community to provide the training or to like ask them, like, how can this be better for you? If we were to pause, if we were supposed to do remote, special needs students, especially our ELL special needs students, like how do we get you to the school, right? Like, will there be, or we want to say to them, there'll be transportation, safe transportation to pick you up. We'll coordinate with your family because that's a huge thing, right? With immigrant families, communication is key. So I would say we need to maximize our planning right now, maximize our opportunity, use the ARPA and ESSER funds to develop a pipeline for teacher diversity, to develop a pipeline for parents and students to engage with our districts. And I know I have really great relationships with superintendents and with teachers and administrators. And when you are trying so hard every single day and then a crisis happens and you have to put in that extra effort just to make sure the ship just like stays afloat, right? The extra resources and the planning now is gonna hopefully lessen that stress on the school system and to be able to hold the families and hold the students together so that they feel that, even if they're in remote, they have a sense of belonging, right? And when they come out of it, what's so great is that when they come out of it, they'll have a sense of belonging at the school. And that is like, for us, for parents and for educators, that's golden. And that's where we want to get our families and our schools, that everyone feels welcome and they have a sense of belonging. They've been able to really be part of our democracy, to be able to, have a great public education system that will allow them to meet their full potential.
Do you feel
so
like
we can, yeah.
What I was gonna say, do you feel like if there was another wave in the fall or the winter, you'd want to see schools pivot to remote again, or you'd want to see them try to keep kids in school?
I think that that is a question that we have to think about. I think that if you can go remote for the students who can work well remote, that would be great. But so then that allows like the staff and the administrators to really provide special care and planning or to execute that planning for like our ELL SPED students. Because, you know, the special needs students, as Russell mentioned, need, they will need that in-person learning, right? They need that, the facilities to actually learn. But if we have everyone come to school, the districts that don't have that extra space, as Beth said, or the extra, you know, counselor or the para, are not going to meet the needs of our most vulnerable folks, our most vulnerable students, who are our low-income, BIPOC, special needs ELL students, right? So if we can make a plan where, like, say, like, hey, you know, can we take a step back so that, you know, we can plan this out? Can we take a step back so we can see, like, how is this surge or going to be, how will it last? I think everyone will be in a better place.
I don't want to run out of time, and I'd like you all to have a chance to think about, to say, like, okay, going forward, here's how to make sure the state of Massachusetts does it better next time. And it's hard to know whether, like, next time is 6 months from now or next time is 6 years from now. We really don't know. But what are your sort of 1 or 2 recommendations for, here's what we should all take away from this meeting and think about going forward? Shira, do you want to start?
Well, I sort of thought you might ask this, and I don't want to say the usual things, which are true, right? That we need to make sure that we focus on vaccination and treatment and building upgrades and PPE for the vulnerable, and all of those things are sort of obvious. But there's a thought that I'm starting to have, and I haven't really fully formed it, but I'll share it anyway. And it's about messaging, and it's about clear, factual education with talking points. And so let me explain what I mean by this. There has been misinformation on both sides of an extreme spectrum here throughout the pandemic. So there have been those who say COVID is a hoax, it's not real, it's just a flu, it's not actually killing people, the death data are wrong, you know, all of that. There are obviously been tons of misinformation about vaccines. But there's also misinformation. It's not disinformation, it's not malicious, but there is also, polls show that people actually overestimate their personal risk. And they believe things to be riskier than they are. So, you know, I've done a lot of webinars and Zooms with school personnel, for example, and I get questions about things, you know, what if I go in the bathroom and somebody was in the bathroom sometime before me and they didn't have a mask on, I'll get COVID. And actually that's not how COVID is transmitted. So how do we, you know, and I think there is a misunderstanding of the level of risk to children, vaccinated children, the true rate of long COVID, you know, all of these things that are bad. Children are getting sick, they're dying, they're getting long COVID, but the magnitude of that risk compared to other risks that we always accepted prior to COVID is not put into proper context. How do we get people to put risks into proper context so that we don't overreact to things and then cause harm? Could it be that the state has some responsibility to provide some level of education, talking points, messaging to schools, and that the schools have some responsibility to provide that type of education to the school community? And might that be a future sort of pandemic goal?
Thank you. Russell, can you talk about, like, what are when you think about, like, recommendations for going forward, what are the things you hope that we think about? You know, Shira talks about a different way of thinking. There can also be different ways of doing things, but either way.
I mean, I think that really this is an opportunity for us to relook at the educational experience for our students in the state and to say that we don't want to go back to just things exactly as they were. And particularly when I think about our students who have been most historically undereducated in Massachusetts, I think about, you know, the need to shift away from a remedial experience in school to an accelerated experience in school. And I think that an accelerated experience in school means that we are providing students with access to grade level content with just-in-time supports, really built on a feeling of a sense of belonging. And I know that I appreciate that our other panelists have really talked about that a lot tonight as well, both for students and their families. And we can't have the student rise to the occasion of, accessing grade level content if they don't feel like they belong in the school, they don't feel like they're welcome on a cultural and linguistic basis. And so our work to do that, I think, is very exciting. I think the time is now to say that we can use the incredible dollars that we have right now to invest in public education through the Recovery Act funds to frankly reinvent the public education experience for our children. And I'm kind of excited to accept that challenge along with my fellow colleagues here tonight, and I hope that we see something better and brighter for our children as a result.
Julie, do you want to talk about what your kind of recommendations are, either again for doing differently or thinking differently?
Sure. So in addition to sort of getting all the decision makers on the same page, I am thinking about Beth's comments related to people in decision-making roles that perhaps they shouldn't have. So, the school people trying to weigh in on the public health pieces. And I was an English teacher, you were a social studies teacher. I wouldn't want to do that either. So rely on the experts in the field. And it goes along with what Shira was saying as well. And I think what happened a lot, there's this great phrase, escalation of commitment to a losing course of action or something like that. And people dug in really hard on all sides, and they invested so much time and energy and emotion into it's a hoax, or everyone's going to die if they come in contact with one another, and it was very polarizing. So somehow if we could let the health experts do their job, let the school people do their job, let the parents do their job, and make those roles clear when we encounter another situation like this, I think that would be highly beneficial.
Beth, do you want to pick up on your
to.
sort of top recommendation?
Sure. Today, there are still schools with mold. Today, we still have schools where the air quality is poor, and that ventilation is not significant, despite having gone through this pandemic, which we know was airborne. We need to mitigate that now. We have children with high rates of asthma in our schools. They don't have some of those same symptoms when they're out of the school for long periods of time. Headaches disappeared. I talked to many families who said my children didn't have headaches while working from home because they had been working in a mold infested, or learning in a mold infested school. So these are things that we have to take care of. We can't pretend that it's not important. These are long-term health risks in themselves. And then layer upon that the risks of a pandemic to children who might already be somewhat compromised. We do have educators of varying risk tolerances themselves because of their own health concerns, varying ages of people with their own health issues. So we just can't forget that there's people in the building that we need to consider at various levels, not just our children. And we do know that loss happened, loss of people that we loved happened, and our children have lost paraprofessionals and teachers and custodians that they knew, but they passed away because of COVID over the last 2 years. We can't minimize that. And there are many children that have lost caregivers from COVID. So there's far more going on here than the normal business of educating our students. I would like to see us focus on the growth of our children as we assess what is going on in our classrooms, whether it be pre-pandemic times or in the next pandemic. If we're measuring what a child is learning, I want to take a look at where they started and where they ended up and give proper credit for the growth that they acquired that year in their or period of time in school. That isn't how we measure. That's not what our MCAS does now. It's a very small portion. It's 25% of what we measure now. But as a parent, I cared more that my children ended up different, improved, enhanced at the end of a school year than necessarily understanding the minutia of a comma. And I cared very much, no offense to the English people. But you know, there's so much more that goes on in the education of our children. And that's what I'd like to figure out how to measure. And some of that is extracurricular activities, it's clubs, it's friendships, it's meaningful relationships with adults that they identify with, whatever they're identifying that's important. So if we want to redo our school system, I say start with the buildings. That's the first place. Get rid of the mold.
You know, I want to, Thomas, I want you to, I think everybody's talked about sort of something that they would like to see happen in the future. I'd like you to wrap it up first, but at the beginning of that, let's just get to this really kind of nitty-gritty point that Beth has talked about with ventilation. Joseph Allen at Harvard has talked a lot about this, about making air quality in schools, but also office buildings and other places better, not just for COVID, but as COVID joins a whole bunch of respiratory viruses that cycle through, what's the, you know, the importance of better air. I just wonder, what's going on with the air in the New Bedford Public Schools? Has anybody helped you with that? Has that been something that has gotten funding? Can you just speak to that first?
To that, what we did when the pandemic set in, we had a company come in and assess the airflow in all the buildings. In a term we didn't use air quality, because people need to remember all of the buildings were already certified for occupancy. So if there was something that was identified prior to that, we were already working to mitigate it. So our buildings in there, you know, we have a handful that are over 100 years old. So during that process, we had someone come in, they did an assessment, you know, some things had to be fixed, some windows, there were some areas that were, the airflow was not good. So we committed to not using that space until we repaired or did whatever we needed to do in that situation. And the other part is, when the report came live, we had our bargaining units, so our unions were right there to receive the information as we received it. So that completely made things transparent. We shared with people, this is what we're doing. Now, that doesn't change the fact that we have some buildings that are very old, and we've been working through processes now just to get new buildings in general. But that was one thing that we did right from the beginning, to be able to open up on that September 15th, it was with those students. And I committed, because it was in August, and we said, if we cannot use the space and have students spaced out appropriately, we were using the 6 feet distancing at that time. And we were preparing to have, you know, we had 9,000 students in the buildings, you know, we have a little over 13,000 total. So 2 days a week, we had one set, 2 days a week, we had the other set as we got closer to October. But when we had our most vulnerable populations, our students learning English and our students with IEPs in there in the beginning, we had already checked all of those areas. So that was it. But the biggest point was, everyone kept talking about, you know, ventilation and air quality. I said, but your buildings are already certified for occupancy. You have to control that narrative. And as we, you know, there's some other points we're talking about, the just that piece of the different sides and the different perspectives that go into that. And the other thing I want to mention, and we'll get to the other point, is because it was suggested now, DESE did a lot of work. Was everything perfect? Of course not. We don't do perfect things. But the one thing that they did do, when we talked, someone had mentioned about having them have talking points, the conversations and the information that we would get from, you know, the commissioner's office and his team, including Russell, again, and as to Julie's point too, there were things that were shifting and everyone wasn't always on the same page, but the effort was there to make sure that that information came out. The one thing when I speak to my colleagues is that you are the leader of your system. You understand your community. you can't look to the outside people. You can't look to DESE. You can't look to the individual to think that they're going to come in and tell you exactly what you're supposed to be doing. And I think individuals who've experienced in some extra challenges, there are some things we could have done. When we think about hindsight, yeah, there are some conversations that should have been done a little differently in the beginning, kind of going through that piece.
I think, did I get everybody in your, I think everybody has done a little bit of looking forward and what they'd want to see, right? I just want to thank all of you so much. I'll bring David in a second to see if he has any more questions, but I just want to thank all of you. I think this, like I said, this has been a 2 years that's been really tumultuous. There's been a lot of very, very difficult decisions made, and many of you are making those decisions. And, you know, I personally feel like there's probably a lot we could do better. And we heard some of it from different people in different ways here tonight. And I think that's really important, because if you just put it all in the past and you say, well, this will never come up again, I think you're sort of cheating yourself out of an opportunity to think about how the future could be better. And I think about like different things that different folks said. Thomas, you wanted to say something.
Just one thing, because I saw some of the comments in the chat and they keep talking about equity. And if we're thinking we're going to be committed to really making sure that there is real equity, people have to believe in it. They can't just keep talking about it. We can't keep saying, well, we need to do this. All of these issues existed before the pandemic. When we talk about, I don't really use the word, we have different terms that we might use, but we know who our most marginalized students have been historically, who they are now. And that has to be a true level of commitment. We can't say that we need to help fund things and then there are 10,000 hoops you have to jump through to make sure you can get that information out there. Or we're committed to one piece, but there are a lot of discrepancies in how that goes. I mean, we can get into details, but I'm just saying the equity part has to be real, and it has to, it can't be where people get to opt out of the conversation. And it can't be just from, New Bedford to Lexington. It has to be New Bedford, Lexington to Pittsfield to Salem. It has to, and then across the country. And if we're not all on the same page as educators, we're going to continue to have some of these conversations. And if we have another pandemic, we will be struggling the same way that we struggled this time.
Do you feel the conversation shifting, or not so much?
I believe that the conversation shifts some, but on the other hand, it's something I live with every day, all day. So it's hard to know, and I'm part of different groups and those type of things for some of our state equity teams. But again, I think people are open to it, but what's real? And I guess that's what it is. What are we going to be talking about in a couple months? What are we going to be talking about next week? Next year. How does that look? And is it sustainable? And that's the thing. We have to have the right and real conversations about it.
Yes. And I think one of the interesting points about equity comes back to that cost and benefits thing. Vatsady talked about it, Shira talked about it, this question of where do they really lie? And are we going to get any better at thinking through those questions as we move forward? I will turn it back over to David, but I just want to thank all of you so much for this really important conversation. And the really nice thing is that you all come at it from very different points of view and very different responsibilities for different kinds of things. So thank you very much. David, let me turn it back over to you.
Kara, thanks so much. I love all the talk about action and actually getting things done. The Mass Health Council is an advocacy organization. That's what we exist to do, to actually make change out in the real world. So folks should know, there is a proposed ballot initiative on a millionaire's tax. If we're going to fix these problems, it requires funding. And this is a tax that would kick in for incomes over $1 million in Massachusetts. And those are resources that you could actually use to address a lot of these problems. So if you're looking for something you can do, get on board with funding sources that can actually solve some of these problems of equity in our schools. This has been a great discussion. I do want to ask really quickly, we have a few minutes left. There are school committee races coming up across Massachusetts. And one of the topics that you hear a lot about are people just running on a kind of anti-mask agenda. They do not want their kids masked ever again inside these schools. And I wonder if folks could quickly address that. Thoughts on, Shira, I'd start with you. Did we get masks right in schools? Should kids have been wearing masks all this time?
Can I just
Oh,
say
that is-
something? Can I just
That
say
is not an
something really
8-minute
quickly?
conversation. You know, I look at the data a lot, and I think that there was a time and a place, and then there was a time and a place to think about stepping away. And I think in Massachusetts, we got it right. We looked at rapidly falling cases. We looked at the approaching lull after the Omicron wave and before whatever comes next. And we are giving our kids that sense of normalcy in most of Massachusetts right now, and that sense of normalcy that they really, really do need, some more than others, because many kids have embraced masks really well. But we would be remiss if we didn't admit that for many kids, that has been one of the harder parts of the pandemic.
Interesting. Kara, sorry, please go ahead.
No. I was just going to say, I had mentioned before that I was speaking to somebody at a School of Education in Copenhagen this week. And I've been looking at different countries' responses to the pandemic and the mask thing. You know, one of the things I think we think about in America is that there's a spectrum, and it's like a left-right spectrum. But when you get into other countries, they don't necessarily, they just are completely different. So like one thing he was saying was that in Denmark, they didn't believe in masking kids under 16. So they didn't for the whole pandemic. But on the other hand, when they said like everybody go get vaccinated, everybody went and got vaccinated. So like the things that we think of as like a right-left binary, other countries like don't, you know, subscribe to the way that we think about things. And I know Japan just added masks for 2 years old and up. So you have different countries doing totally. I was shocked that he said about masks, no masks for under 16, and he just said, well, our you know, I think Department of Education said it's not good for mental health, and we all just said okay, you know, like, so very different approaches.
And if everyone's vaccinated, maybe you can do that.
Yeah.
Right. Could I jump in on one thing that about equity for a second? And it comes down to how we fund the building of our schools. If you look at the funding formula for it, which is different than Chapter 70 and how we just fund our schools to run our schools day to day. This is about, I need a new school, or my school's falling apart and I need to fix it. There's a formula that allows a district to get state funding for a large amount of it, like 80% of the school building, but they carve out things like the auditorium or the gymnasium. And so if New Bedford, which I'm imagining is not as well resourced as Lexington, so if New Bedford needed to build a new school, they would have to have enough resources to add on their own auditorium or their own gymnasium, their own things that I think all our children deserve, right? And in another school district that has resources, is a no-brainer. I'm going to have a nice auditorium added on to my new high school, or, you know, whatever else is added on. And I'm sure Julie can speak to that.
I'm going to jump in because I was a superintendent in an urban gateway community for 10 years prior to my new gig in Lexington. I did multiple building projects in the urban school system, and then we have a project ahead of us in Lexington. And I actually think that the MSBA, Massachusetts School Building Authority, has a pretty equitable formula, speaking from the experience of you know, in both places. So for example, in the community where I used to be, which was Taunton, it was a 74% reimbursement. In Lexington, they have a 32% reimbursement, but the effective reimbursement rate is really more like 25% because some costs are excluded. And it has to do with the number of low socioeconomic status students you have in your school system. And this is one where if the needs are greater, those school districts jump to the top of the list, which is great. What I do see as a flaw in the system is that sometimes people don't have, you know, the capacity because they don't have the staff to be able to submit the applications for the statement of interest. And, you know, that could be an opportunity in terms of how we could make it even more equitable. But I'm, you know, from both perspectives, I have been impressed with the process. And I don't think you have to fund your own gymnasium, but you do, there are ineligible costs that get kicked out. And then the other problem is that, you know, not all people in local government prioritize schools. So it comes down to the vote of your city council or your select, you're not select board, town, town meeting members and that kind of thing. And if you're not educated on need, and if you think, that building was good enough when I went there, those kids are going to be fine with it
all the time. Yeah.
Yeah, then you're not going to get the vote through. And one person who used to work at the MSBA said, like they would go to a district, and the district was giving a ton of challenge about, or the city council was challenging the superintendent and didn't want the project or whatever. And the MSBA person said, I have my pocketbook here with, $100 million. I can give it to you, or I can give it to someone else. What would you like me to do? So educating communities on need for the air quality. The buildings that exist weren't sufficient through this pandemic, the old buildings, just like Beth said, and figuring out how to approach that, and maybe how to prioritize leveraging the resources that are available, because we can make decisions around grants, ESSER funds, the Recovery Act funds, and things like that. And not every school leader made that a priority either. So thinking through all those things is an interesting and complex puzzle.
Can I get back on the mask thing? I think that the message just needs to be consistent. If you're a parent, even if you're an immigrant parent, you're on Facebook and you're in these Facebook groups. And when the anti-vax folks come onto Facebook and they go to your schools and they stalk your principal or your teacher, right, who want to wear a mask, that's really stressful as a parent, right? Like, we just need a consistent message and policy so that we can really just focus on getting our kid to school, like picking them up, working with the school system, right? Not being like, oh my gosh, I'm going to go on Facebook and I'm going to talk to my, the moms group about something else. But then this anti-mask person comes on like full stream, like aggressive, and then that just stresses me out. But that's the reality of it. And I think that people need to really respect other folks' opinions, but at the same time, we need to have that consistent messaging and like information out to our students, public ed on how best to be safe, right? And what your choices are. It's really important. So that's another thing that, if we look to the future and we think about mask policies and communications to family and parents and students, that like consistency is key. And I think that's a principle that we try to have in teaching our kids in general. The more consistent they are, the better habits they will have, or what they can learn is a better learning environment. So same principle here. But thanks for bringing that up, David, because that is a hot topic right now at school and on moms groups on Facebook.
Very much. Well, Vatsady, that's a great way to end, the importance of communication and consistency. A point that a lot of folks have made. Thank you all so much. Kara, thank you so much for moderating this. I think we've got a lot of really valuable information. Thank you all for giving us an hour and a half of a Thursday night. I think the Oscars are on now or something, so we can all go watch that. All right. Good night, everyone. Thank you so much.
Good night.
Thank you.
Good night.